Okay, today we are going to talk about how to reconstitute a medication because we want to hang a secondary bag on our patient. The doctor has ordered us to give 500 milligrams of Practi powder, IV piggyback, in 50 milliliters of normal saline and infuse that over 20 minutes. So the first thing we need to do is reconstitute our medication. To do that, we're going to need our medication, which is our Practi powder. We're also going to need some diluent, which in this case is going to be normal saline. We're going to need a large syringe, such as a 10 cc. We're going to need a needle, also an alcohol pad. So what we want to do first is take out our medication and look at it to see how we are to reconstitute it. On the bottle, you will notice it says to add 10 milliliters of normal saline to this. Once I do that, then what I'm going to have is a concentration of 200 milligrams per milliliter. So, in order to reconstitute this, I have to add some diluent to it. So, I'm going to need a needle and a syringe. Remember, when you're doing this, to be sure to keep both of these ends sterile. So, you're going to hook these up just like this. Don't touch either end. Also, since this is a multi-use vial, I'm going to go ahead and clean the top of it because I don't know if it's been touched. So be sure you clean that with an alcohol pad. Now, this says on here to add 10 milliliters, so that means I need to draw up 10 milliliters out of here. So I'm going to draw up 10 milliliters of air and add this to my vial that has the normal saline in it. And remember, you can draw down past the 10 mark just a little bit if you need to get your bubbles out. Little champagne bubbles are okay. You just don't want large bubbles in there because that's going to displace some of your actual medication. Okay, so we are going to be at the 10 milliliter mark. Then I'm going to flip this open. As long as this hasn't been touched or contaminated, then I don't have to clean it. If it's been touched or been opened before, I would have to clean it. Now, I'm going to enter this, push all of this in there, and you're going to feel a lot of pressure. When you push down really hard on this, it creates a lot of volume in there. So hold down on your plunger when you take it out. It may even spray you just a little bit. Okay? Now I'm going to recap this needle because I may need to reuse it. Remember, the one-hand scoop method. Okay. Then I want to mix this. Gently mix it by rolling it between your hands, or gently inverting it upside down. Don't shake it vigorously because it's going to add bubbles, air bubbles to the fluid. So once you have this nicely mixed, and you can look at it, once it's kind of clear and there's no more sediment in the bottom of it, then you're ready to draw it up. So now you need to calculate how much of this do I need to draw up to add to my secondary bag. The doctor's order was for 500 milligrams. So 500 milligrams is my desired. So we're going to use the formula D over H times Q. My desired is going to be 500. What I have is 200 in 1 milliliter. So it's going to be 500 over 200 times 1. And that's going to, once I calculate that, that's going to let me draw up 2.5 milliliters of my Practi powder. Okay, now what I'm going to do is draw up my 2.5 milliliters to add to my 50 milliliter bag. So I'm going to use a 3 cc syringe because it has a half mark on it. If you'll notice on the larger syringes, they don't have a half mark on them. They are measured in 2/10 of a cc. Be sure you don't contaminate either end. Go ahead and put this on there. Again, clean the top of this because you may have touched it. You do not have to add air to this. Go ahead and just enter. We have volume in there from the fluid we added. And what I'm going to do is draw up 2.5. And again, the 3 cc syringe is just more efficient in this case. You can go ahead and pull past it and then push back up to it to get all of your air out. Okay, so I'm going to have 2.5 cc's, and that's what I'm going to add to my secondary bag. Go ahead and check your secondary bag. Look at the expiration date. Again, squeeze it just gently to make sure there's no holes in it, and look at it to be sure there's no sediment. You don't want anything floating around in it. Again, on this bag, it has two different ports. One port is for injection, one port is to spike it with the secondary tubing. So you simply have to flip this off of there. Don't touch that, it's still sterile. If you touch it, you have to clean it with an alcohol pad. Enter this port with your needle straight in. If you go at an angle, you'll puncture through the side and you'll have to get a new bag. So go ahead and put your medication in. And you're basically finished with that part. Go ahead and mix gently. Try not to create a bunch of air bubbles. So by gently just kind of flipping it back and forth and side to side, you should see a little bit of color to your bag. Now the next thing you want to do is make a label and put your label on before you even leave your workbench. So you're going to put your patient's name and or just initial. Let's say I've got my initials, maybe an ID number or room number. My drug in this case is going to be Practi powder. My amount is not the 2.5. My amount is 500 milligrams because that's how much of the drug I added to it. So 500 milligrams was added by me, so I'm going to initial it. My base solution in this case is normal saline, and you can abbreviate that NS. The date is today's date, which is October the 25th, and what time I mixed it, which is 3:05 p.m. And you can use military time if you want. Start time and date are when I go in to actually start the medication, so you leave that blank until you go to the room to start it. You want to take this label, place it on the bag, if I can get it unstuck. Place it on the back of the bag so whoever's looking at this later can come in and see what your base solution is. So once I place this on the bag, I'm now ready to spike this and take it to my patient's room.